there, this is Ashley from Mamas Connected, your online source for all of your women's health questions. If you are pregnant and experience bleeding, it can be a terrifying experience. Bleeding during pregnancy creates anxiety, as this can sometimes be a sign of miscarriage. However, some women who have heavy bleeding during pregnancy go on to have a healthy baby. We will be discussing subchorionic hematoma, one of the causes of prenatal bleeding. First, what is a subchorionic hematoma? Well, a subchorionic hematoma, also referred to as a subchorionic hemorrhage, is a type of bleeding that occurs between the uterine wall and amniotic membrane. This bleeding occurs when the placenta becomes partially detached. Many women wonder, am I at risk for a subchorionic hematoma? There are several potential risk factors for this condition. These include trauma, preeclampsia, high blood pressure, a history of recurrent miscarriage, a history of pelvic infections, and malformation of the uterus. Subchorionic hematomas are estimated to account for 10% of vaginal bleeding that occurs during pregnancy. So, the big question, what are the signs of a subchorionic hematoma? Many women who experience this condition incorrectly assume that they are experiencing a miscarriage. A subchorionic hematoma is often characterized by bleeding and cramping. In some cases, however, a woman remains asymptomatic, and the subchorionic hematoma is revealed on a routine ultrasound. So now, the most important concern. Will a subchorionic hematoma affect my baby? Rest assured, many women with subchorionic hematomas will give birth to a healthy baby. However, there are risks involved with this condition, depending on its size and when it develops. Larger subchorionic hematomas may pose a greater risk. Additionally, there is a higher risk if the subchorionic hematoma is discovered in the first 20 weeks of pregnancy. Patients with this condition who experience bleeding and cramping may have a higher risk of miscarriage. How can I treat a subchorionic hematoma? There is no surgical treatment for this condition. Your provider may recommend decreased activity, or in some cases, even bed rest. Women with this condition may be advised to refrain from sexual activity. In many cases, a subchorionic hematoma will resolve on its own. A subchorionic hematoma is a potential cause of prenatal bleeding. Many women with this condition may initially incorrectly assume that they are having a miscarriage. Although subchorionic hematomas create additional risks, it is important to remember that it is possible to have a healthy baby following this diagnosis. Thanks for joining me as we took a close look at subchorionic hematoma, a potential cause of bleeding during pregnancy. If you are interested in watching similar videos, please subscribe to my YouTube channel and check out our website, mamasconnected.com, which provides up-to-date articles on all of your preconception, pregnancy, and new motherhood questions. You can find the link to our website, Mamas Connected, in the description below. Until next time, my friend.